Okay, this is the second part of the heart, and the first objective we need to look at is looking at the heart activity and how it can be monitored by ECG trace, which is an electrocardiograph, a pulse, and the sound of valves, which is that lub-dub sound that the heart makes when the valves open and closing. The way the brain sends messages to the heart is by sending impulses, electrical impulse or nervous impulses down the spinal column, down neurons or nerves, and these get to the heart. Now, once they're at the heart, they reach this sinoatrial node. You don't need to know the name of that. It's called the pacemaker, which you do need to know the name of. The pacemaker then, in a similar fashion, sends waves of electrical messages or impulses down through the atria, which then cause a contraction, and then these waves of excitement or electrical impulses go down to the ventricles and cause the ventricles to contract. So the atria contract first, and the ventricles very quickly after. There's two types of neurons that go to the heart: one that accelerates the heart, speeds it up, and one that slows the heart down. So how that works is the brain has sensory receptors. Sensory receptors are things that detect things, and these detect the levels of CO2 and O2 and blood pressure. So there's three things they detect. And now a decrease in blood pressure or oxygen concentration or an increase in CO2 concentration causes heart rate to increase. The pacemaker is stimulated by these electrical messages more, therefore the heart rate can be adjusted. The release of adrenaline also increases the heart rate. That means, when you're stressed or excited, you're going to release adrenaline. That's going to happen. When it's released into the blood by adrenal glands, it reaches the heart and increases the rate and strength of contraction. Now, a pulse is just a ripple of pressure. It travels down an artery, and basically what you'll feel when you take your pulse is an artery expanding and contracting as it increases in size, because a large volume of blood is traveling through it and stretching the walls. That's what you feel when you feel a pulse. Now, a pulse rate is when you measure that. Now, pulse rate is measured by placing your fingertips on the radial artery of the wrist or the carotid artery of the neck. Don't use your thumb, because your thumb's got a little pulse and you don't want to get confused between the two pulses. That just shows you the radial artery of the wrist and shows you how you would take your pulse there. Now, digital pulse rate is just a more accurate way of measuring the pulse using technology, and you place monitors on the earlobe, finger, or wrist to measure the pulse. Also, the heart makes its own sounds, and it magnifies sound from the valves opening and closing. Now, again, that's that lub-dub sound, and you use a stethoscope. Doctors, those are the things that they wear around their neck. They plug them into their ears and place that little cold thing onto your chest, and that magnifies the sound coming from the valves opening and closing. Lub is the sound of the valves closing, and dub is the sound of the SL valves opening. Faulty valves are identified if the lub-dub rhythm is out of sync. An ECG, electrocardiogram. Electrodes from an ECG machine are attached to your skin on your arms, legs, and chest, and basically just measures your electrical activity, which is all your signals from your brain to your heart. Irregularities can be identified because you can see on the spikes there where there's a lot of electrical activity as the heart is contracted, and you can check whether the pulse is irregular by seeing where the spikes are in the ECG trace. Now, an investigation here is to see how exercise affects heart rate. You've got to first find your pulse, which is using that radial artery or carotid artery in the neck. You count the beats in 15 seconds and multiply it by 4 to work out your beats per minute, which is BPM. You repeat that twice and calculate an average. You need to know how to calculate an average and why we calculate averages. Exercise for 2 minutes, and then measure the pulse immediately after exercising using the same procedure as before. Then measure it again every minute after exercise for 10 minutes. What you can do then is plot a graph of all of those pulse rates for all of those time intervals and draw a line across it to indicate your resting heart rate. So this is a graph to show you how your heart rate would decrease gradually after exercise. Notice that the intervals there are every minute, and the heart rate is measured and recorded every minute, and it shows a decrease steadily back to resting heart rate. You draw a line across what your resting heart rate is, because as this plateaus, it would steadily flatten out. That would be your resting heart rate. There's two different resting heart rates here. They just show resting heart rates of someone who is fairly unhealthy, and then fairly healthy and active is the red line. Now, looking at data from individuals exercising, you need to be able to explain that younger, female, unfit people have the highest heart rate. So that would be this blue line here. And then older, male, and fit people have the lower heart rates there. Younger people, just because they've got high levels of respiration for growth. Now, oxygen debt is basically paying back oxygen after exercise. When we exercise, we create chemicals such as lactic acid, which poison the bloodstream and cause pain, which makes us stop exercise. Oxygen debt is keeping an elevated level of breathing so that you can get more oxygen into the body, even after exercise, to remove such chemicals like lactic acid. Now, this is basically what the heart rate beats for. It's basically to pump blood to the body and lungs, and it carries waste CO2 to the lungs for removal by exhalation, and it collects oxygen from the lungs to transport it along with glucose to respiring cells. That's the whole point of the heart beating. Okay, during exercise, skeletal muscles contract more, so they respire more, and so need more glucose and oxygen for that process, and therefore produce more CO2. The heart has to pump faster to increase that supply of glucose and oxygen, and breathing rate therefore increases as well. If not, the muscles will respire anaerobically and produce that poison, lactic acid, which causes fatigue and pain. Rest heart rate is normally 70 beats per minute, but it's higher if you're younger, female, and unfit. Heart rate can increase up to 200 beats per minute during exercise, and it decreases steadily afterwards. And again, oxygen debt is just what we described before. Now we need to describe such diseases. Now the main one they talk about is the coronary heart disease, which is basically the blockage of a coronary artery. Remember where the coronary arteries are? They're the arteries that run through the muscle of the heart. Now, an atheroma is deposits of fat in the lining of an artery, and it's not a problem until it blocks an artery. Now, atheromas are created by either blood clots on damaged lining getting covered in atheroma, or by fatty substances in the blood passing into the actual lining of the artery. Now, here's a picture of an artery. You've got a longitudinal picture and a transverse picture. So here you can see the lining and the lumen where the blood flows, an atheroma of fatty deposits that either get into the lining or where blood clots that might be in the lumen get covered in atheroma. Here's an atheroma here. You can see it attached to the lining here. The lumen is partially blocked. A thrombus is where an atheroma causes a blockage. It's made from fibrinogen and plasma, and it's called a blood clot. Coronary thrombosis causes a heart attack when a thrombosis stops the supply of oxygenated blood to ventricles. Therefore, they can't respire and they can't contract, and then that leads to the heart attack. Danger areas. Now, for atheromas, if they build up in the brain, it can cause a stroke, and if they build up in the heart, it can cause a heart attack. Again, another picture here showing how atheromas can cause a thrombosis and lead to heart attacks. And remember, this is in the coronary arteries. You can see the fatty fibrous deposits here, which is the atheroma. And once it blocks the artery here, it's called a thrombosis. and these are where red blood cells have all stacked on top and blocked the actual passage. Now, the next part we need to talk about is the risk factors for certain coronary heart disease, such as our diets. Now, the Western diet is depicted to have too much fat and sugar. Atheromas contain cholesterol, which comes from the blood and is needed, but too much cholesterol from such fatty diets can cause extra formations of atheromas. Cholesterol levels particularly increase if you have saturated fats, so animal fats or greasy fatty foods from fast food. Unsaturated fats from vegetable oil help to lower cholesterol levels. High sugar causes obesity, which then can put a strain on the heart. So sugar and fat can cause coronary heart disease. Emotional stress can lead to high blood pressure, which increases the rate of atheroma formation as parts of the blood can be forced into the lining and then cause an atheroma to be made. Genes is just what you inherit from your family. Age and gender are basically older, and if you're male, you're at more risk from heart attack. Sorry, lads. And exercise. Lots of contraction of the heart keeps it toned and strong, just like any muscle in your body. So there's no room for atheromas, no gaps for them to form. The heart basically needs to pump less to provide the same volume of blood as it's stronger. Vice versa, lack of exercises causes gaps in the lining as the cardiac muscles become weak, and therefore atheromas can be caused in those gaps, and coronary blood flow is restricted in muscles because they're not toned. Smoking. Carbon monoxide damages the lining of arteries, so more atheromas can be made. Now, in more detail, there's no real evidence that smoking causes an atheroma, as you can't conduct an experiment because it's really dangerous to get people to start smoking just to see if it causes them to have a heart attack. But you can collect evidence from long-term studies that have been done. And you can find correlations from statistics of smokers versus non-smokers. And it does show that a general trend that if you smoke, you're more likely to get a heart attack. Other arguments that go towards smoking causing heart attacks is that smoking can cause bronchitis and emphysema, so less oxygen can be absorbed into the blood, and therefore the heart has to work harder to pump more blood to get more oxygen to respiring cells, and again can lead to heart attacks. But again, not a lot of evidence towards that. Other arguments against is that they could actually just already be prone to heart attacks, like if they had high blood pressure, that would cause them to have heart attacks, and it might not actually be the smoking, but most of the evidence points towards smoking being damaging. Other correlations are that if you have a TV set, then you're more likely to have a heart attack, just because the lifestyle you might have if you have a TV set is kind of just eating fast food and being kind of lazy. The graph here shows annual death rate from coronary heart disease in males and the amount of cigarettes smoked. So you can see there's a massive correlation there. Not only an increase in males as they get older, but an increase in as you smoke more cigarettes, you will probably die from a heart attack. This one we've already discussed, the roles of diet and exercise in preventing CHD. So there's a reference there for you to use. Next thing we need to talk about is how CHD is treated. That's coronary heart disease, how it's treated. It's normally treated by drugs or by surgery. Now, aspirin prevents the formation of blood clots. That can reduce the chance of atheromas and thrombosis being caused, and so reduce the chance of coronary heart disease. However, as with many drugs, there are side effects. Now, this is angioplasty, where you take a thin tube called a catheter and push it through the narrowed artery, and then you attach a balloon to it, a small balloon obviously, and you inflate the balloon. This then pushes the linings to the side and opens the lumen up to reduce the blockage caused by the thrombosis or atheroma. A stent is where you have a little meshwork of metal with the catheter, and as the balloon inflates here, it pushes the stent outwards, and then that stent is then deployed and left there and keeps the lumen of the artery wide so blood can flow. Another thing to say about stents is that they have chemicals which prevent further blockages. Now they're invasive, but it's not as invasive as a bypass operations, and patients can usually leave the next day. Now, bypass surgery is a lot more dangerous. A section of blood vessel is taken from the leg, maybe an artery in the leg, and it's attached around the blocked artery to bypass it. So then the blood can travel around the blockage, and that's called a bypass. It's open heart surgery though, so it's majorly invasive.